Future is never an extension of the past. It is different. And COVID has opened everyone's eyes, and it has disrupted every aspect of human life and the existence. The maximum impact of COVID we are going to see in the way healthcare will be delivered in the future. Global healthcare and wellness industry. Today, I would like to just talk about how technology is going to disrupt this industry. May not be only about the air mobility. Global healthcare and wellness industry is over $8.6 trillion industry. Sadly, after spending $8.6 trillion, less than 20% of the world's population has access to high-tech secondary and tertiary level healthcare. And it is not going to change until the healthcare industry embraces digital technology. And this is the only hope for 80% of the world's population. Today, sitting here, we can dream of any technological, innovative products available to citizens of our country. Anything is possible, but there is only one roadblock. Do we have the money to have it? So as far as I am concerned, if a solution is not affordable, it is not a solution. So I strongly believe that digitization is the only future, because digitization will make healthcare safer for the patients. Today, healthcare is not very safe for the patients. Even in country like United States, medical error is one of the largest causes of death. And digitization, taking away the pen and paper from the hands of doctors, nurses, and technicians, can bring down the medical error significantly. And digitization will make healthcare accessible and affordable. Imagine a situation where every patient past the age of 60, he walks into our office, they have this thick file with all the medical records. It is impossible for any doctor to decipher it in 10 minutes they have. Imagine all the data is stored in the patient's mobile phone with a barcode reader or a scanner. And if the patient comes to my secretary and submits the EMR to my file, and in no time I can go through everything. And that experience is possible in every industry today in our country other than healthcare industry. We believe that irrespective of what patient has, within the next 2 to 3 years time, starting from headache to heart attack to cancer, first time consultation will happen online. Patients are going to see the doctors in their own drawing room, from their own drawing room, sitting on the couch with their mobile phone in the hand, and they will be able to consult any of the specialist or a super specialist doctor. And this is going to happen whether as senior doctors, whether we like it or not. This is the reality, and we should be prepared. And there will be, when this kind of a transformation happens, healthcare outcome will be outstanding, because most of the diseases will be diagnosed at a very, very early stage. And most of the chronic diseases like diabetes will be treated much better, because every time the blood sugar goes up and down, if the patient has to see the doctors, he will lose 1 day of work and the wages and the inconvenience. So they just continue to manage themselves with a high sugar or a low sugar. Now, if there is a way they can communicate to the doctors with the simple communication tools like messages or a WhatsApp, and give them the message, within 2 hours they can get the reply from the doctor and his team as what should be the next dose of insulin. And this can be done without much effort, much cost. And I strongly feel that within the next 2 to 3 years time, smart software in the outpatient will make smarter diagnosis than the doctors. And within the next maybe 5 years, 7 years time, it will become legally mandatory for the doctors to get the second opinion from the software before starting the treatment. This is the reality, whether we accept it or not. Now, all these changes, we feel it will always take 10 years and 20 years. It is not going to take that long. In state of Uttarakhand, 5 years ago, the Chief Justice of Uttarakhand passed a judgment that in the state of Uttarakhand, no doctor can prescribe the medicines on a paper. It has to be on a digital tool. Unfortunately, the infrastructure was not ready, but the court has moved ahead of the doctors and the infrastructure. And this is the reality, and this is going to happen. And when all this transformation happens, hospitals of the future, I'm not talking about the distant future. I'm talking about the future, which is another 3 years or 5 years time. When you enter the hospital reception, there will be a reception without receptionist, because there is no need for receptionist. Everything what a receptionist does would have been done previous day or 2 days earlier by patient sitting in his house, receptionist working from home. Entire registration process, entire payment, everything will be done before the patient arrives at the hospital. All the patient will have in the mobile phone the timing of the consultation, name of the doctor, and the room number. That's all. And that will allow the patient to go to the doctor. And when he sits in front of the doctor, the usual question doctors ask is, what is your problem? But that will change. Doctor has the entire history of the patient, and doctor is going to narrate the patient history to the patient, waiting for some additions or some changes, and the whole experience will be different. And the patient will be so happy that first time he is meeting a doctor who knows everything about him. So there is a huge trust factor which will be built in the whole process. Then when the patient is in the ICU, you visit the intensive care. Intensive care unit will not have intensivist. Intensivist will be working from home, because across the world, best care in ICU happens only between 9 to 5 p.m. 16 hours in a day, patient gets suboptimal care. That 16 hours in the 24-hour cycle, if you split into 4 hours, and let the intensivist stay at home, he can see the patient in a laptop or a desktop sitting in his house. He can talk to the doctors, he can talk to the nurses, he can talk to the patient. And that all those technologies are available, which we are piloting. I'm not talking about the technology of the future. This has happened in every industry, and it has to happen in our industry. And COVID has taught us that in a hospital, there should be only people who are going to touch the patient should be working there. People who are not going to touch the patient, they don't need to be there. Why should we expose hundreds of these young girls and boys carrying one blood sample from one bed to the blood gas machine? A cheap robot, which is designed to carry all those samples, can be doing this job. So essentially, most of the transportation activity inside the hospital will be done by very, very inexpensive robot. And let's now look at what can happen if you have a freedom of creating various vehicles for air mobility. If Garden City of Bangalore, which eventually became a tech city, if it becomes a drone city, which has the permission to fly drones across the city of Bangalore, do we need that many blood banks? We need few blood banks, and all the hospitals can be linked to the blood bank. Then look at the efficiency. Do we need that many laboratories to do blood tests? We can centralize most of the blood. There can be collection centers in multiple places. If it's a matter of, there are already pilots conducted by Amazon and various pizza companies in shifting all these pizzas and various things people buy online. So it is a matter of time. All these things, what I'm talking about, will become a reality. In Africa, there are very few blood banks. Entire blood supply of Africa, most of the countries, are done through the drones. So essentially, imagine a situation if we have the freedom of flying drones everywhere. Somebody develops a cardiac arrest and there is no defibrillator. You can fly the defibrillator from one destination to the other with your mobile phone. So essentially, many things can happen. Now, coming back to the air ambulance. Air ambulance is a necessity tool for every country. Now, in our country, unfortunately, cost of air ambulance is 10 times more than the cost of the treatment. And that is the reason why air ambulance hasn't picked up in spite of all the efforts. We have to change the way people they get the services of air ambulance. If the patient has to pay for every air evacuation, it is not going to be affordable for most of the Indians. Now, imagine if we collect maybe 50 paisa from the toll collection in the on the highways. If you collect just 50 paisa from every time you cross the toll booth, but in the process, anytime there is a road traffic accident, the air ambulance will pick you up in less than 10 minutes. Because most people who die following road traffic accident, they don't die because of the injury they sustain. They die because of the blood loss during the entire duration of transport from the site of accident to the site of care. And with the air ambulance, which can be easily, which can land on a highway or next to the highway, we can address this. So essentially, all these services to become popular, we need to create a vehicle for people to contribute indirectly rather than directly. We obtain many services, like as I was explaining about the air ambulance, and if the air ambulance has a viable business model from the money collected from the toll booth, then other air evacuation becomes affordable because the maintenance cost of the air ambulance will be paid by the money collected from the toll booth. Then they have to just pay for the fuel and the maintenance cost. That's all. There is no infrastructure cost. So essentially, all these changes will happen, and it will happen much faster in our country. I'll give you an example. Today, if you have to buy a health insurance, the premium is formidable for most of the Indians. But I'm sure you are reading in all the social media and various the tools we read, and we digest the news in online. There are advertisements coming for health insurance to cover 1 lakh rupees of health insurance with a premium of 999 rupees and no questions asked. Now, smart people like us will say that, oh, this is the unviable business proposition. They are going to close. But believe me, they will not close. They shouldn't close. If we want to see a different future, they shouldn't close. We have to support them, because these are the kids who are not scared of taking risks. They want to change the world. They may not know how to change the world, but they will make mistakes and they will learn. And in the process, in the end, they are going to teach us the lesson. Because everything which transforms the world always starts as an unrealistic and unviable proposition. But in the end, if the objective is honorable, they will always succeed. And this is what we need to do in our attempt to make air mobility accessible and affordable to everyone. There is no point in having these services affordable to the people who can afford to pay lakhs of rupees. It has to be affordable to the common man of the country. How all this happened? Today, every aspect of entertainment, what a rich man has access to, even a poor man has, just by paying 100 or 200 rupees per month in his mobile phone. All these things have happened because of the, I would say, audacity or the ignorance of the young people that certain things cannot be done. And our job should be to encourage them. Once again, I'm extremely grateful to you, for all of you, for giving me the opportunity. Thank you so much. And I would like to wish all the best for all your endeavors to make air mobility affordable and affordable and accessible service for every Indian. Thank you so much.